Laura, for letting you share your video today. We're going to be doing some Sculptra for the neck area with a little bit of the sun damaged skin. So we've marked these areas where we see a little bit of the crepey skin. We're going to inject. You'll see some result today and then it fades away, and then at 3 to 6 weeks collagen starts to build. I like to do a 6 to 8 week follow-up because at that time we're going to say, okay, we like it, or do we add more? Or we've also talked about tightening, but that's the first step we're going to do now is the Sculptra. Any questions about our goals for today? So can I ask you, what was it that inspired you to do a treatment for the wrinkles in the neck? What
Because I
inspired
don't
you?
like the way it looks in the mirror when I look at myself.
Okay, well you've come to the right place, and Sculptra is a great treatment. And with Sculptra, I'm going to rest your head back just a little bit. With Sculptra, you can use it really anywhere on the face or anywhere on the body. How is that? Is that okay for you like that?
Yes.
So we're going to have you tilt your chin up so we can access underneath. So we're basically going to access all through these areas. And Sculptra can be used for face, around the eyes, neck, décolleté. Sculptra is also used there. You're doing a non-surgical Brazilian butt lift, and even cellulite, we can use that. But for today, we're just using it right in through this area. So Sculptra is very versatile that way. I won't use permanent fillers for something like this because you want to thicken the skin overall. So this is a very common way that we use Sculptra. Now, I am going to need a cannula here. So I've got my 25 gauge cannula, and I got my numbing medicine. So a little more cleanse. I like to use for the physicians and students that are watching. I use the Hibbett cleanse, and I also use the alcohol to cleanse the area. It's very rare that someone has a sensitivity to the fillers, and there are no contraindications for getting the vaccine, the COVID vaccine for fillers. I had my vaccine last week, and I've had my facial fillers, so no problems there. So the way I like to do the numbing medicine, you'll feel a little pinch here on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad?
Not too bad.
Okay, so pinch on 3, 1, 2, 3, pinch. 1, 2, 3, pinch. 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 So I'm making a little bit of a grid, pinch. So that allows me to spread the product, 1, 2, 3, pinch. Pinch. And pinch. So we're going to blend that Sculptra a little tender there. Blend it all through this area. Pinch. Pinch. And pinch. You feel small, medium, big pinch there?
Medium.
Medium. Okay, how about now? Are you feeling any pain?
No.
Okay, a few more pinches. 1, 2, 3, pinch. Pinch. And then pinch. So we're on a mission to stop bad plastic surgery and do things the right way. Everybody needs to know the ABCs of cosmetic treatments. A is for area. There's 4 areas we address. If we sag, we tighten. We lose volume, we fill. That's what we're doing today. Sun damage to the skin, we can polish and repair the skin. You feel a little bit of a pinch there? Not too bad? And the 4th area is better than everything else. That's our behavior. The smile always looks the best, and the smile is our model. You feel a little pinch. So the cannula is a blunt tip cannula, so that's why I make these little insertion points where we're going to insert the cannula. And I'm going to focus more centrally, but I'm also going to be going a little bit laterally as well. So that's just a little pore size insertion point for the 25 gauge cannula. Perfect. Pinch. Running through here. So my team has everything set up perfectly. So the 4 areas, if we sag, we tighten. If we lose volume, we fill. Sun damage to the skin, smile is the most important of all the areas that we treat. Those are the 4 areas for the ABC. B stands for boundaries. I'm going to go through that. I like to mix the Sculptra immediately before I inject it because it can settle. So this ensures you're going to get your best result and the most uniformity of the product. So I find that little pore, and we're going to feather. This is all subcutaneous. So you might feel a little pressure, a little pinch. Twist, twist, twist to advance the cannula. Everything's looking good. And I feel there's a little bit of scar tissue there, but not too much, and that's to be expected. I'm going to have you turn your chin all the way to the side. That's perfect. And that allows me to access the area. Laura, you doing okay?
Mm-hmm.
If you need a break, you let me know. You feel big pinch, little pinch, not too bad?
Not too
Okay, good. So the boundaries for good cosmetic treatments. Safety's always first, a little pressure pinch. You must look natural. You want to prevent future aging, and then let's get as much improvement as possible. Now, we can't make things perfect, right? We're not God. We do the best we can, and if we need to come back another day and do more, that's better than going too far. A little pressure pinch here. Everything's looking good. So you can see this is all subcutaneous. And we're just feathering it back and forth. Very good. I like to tell my patients to take a big deep breath in and out. There we go. And if you're watching, take a big deep breath in and out. You'll feel it start to get very numb through this area. And there's numbing medicine in with the Sculptra. Okay, so the boundaries for good cosmetic treatments. Safety first, you must look natural. If you feel a little lightheaded, I can lay you back in the chair. You doing okay?
Feeling lightheaded.
I'm going to lay her back. So that's called the vasovagal response. And that can be very normal. And then when we lay her back, she'll feel better very quickly. The blood can flow down to the legs, and then we feel a little bit lightheaded. So I'm going to lay you back. And there we go. Does that feel a little bit better laying back?
Yes.
And then we're just going to put our little drape over top. There we go. Does that feel better laying back?
Yes.
Okay, very good. So I'm going to tilt you back just a tiny, tiny bit more. And that can be a very normal response, and so that's why we have these chairs where we can adjust the patient position. And have you turn your chin up just a little bit. So you feel still a little lightheaded or not really?
Not, it's getting better.
Yeah, it fades away very quickly when you lay back. You feel a little pressure pinch here or just pressure? Pinching?
A little bit.
A little pinching, and then that pinching is going to fade and settle because there's a little pinch there, a little numbing medicine. So we're going to go slowly. And the goal is we want to thicken the skin for the collagen deposition. So we're going slowly here. Everything's looking good. Little pressure pinch. Big deep breath in and out. Okay, so for now, that's one little syringe. We've got a few more to do. The good news is there's no downtime with the Sculptra. You feel a tiny bit of numbness through there?
Mm-hmm.
Okay, so it'll get more and more numb. No restrictions. I like to recommend 5-minute massage 5 times a day for 5 days. So A for ABC for plastic surgery, A for area, B for boundaries. C stands for combination. If we want our best results, we combine. You combine tightening, volume, and skin to get your best results overall. Let me have you turn your head this way just a little bit. If you want your best results with just one treatment, then we talk about tightening. And if we want our best results with no downtime, we talk about fillers. A little pressure pinch here. Fillers do a great job, but they don't give us a facelift. A little pressure pinch. And there's a tiny bit of scar tissue there from your previous treatment. I'm going to put a little bit of numbing medicine. Big deep breath in and out. It's a little tender, so we'll go slowly. And we'll come across through this area. Everything's looking good. Pressure pinch. I'm going to put a little bit more numbing medicine. Because there's lidocaine inside of the Sculptra. Pressure pinch. Everything's looking good. You feel a little pressure pinch here?
No.
Perfect. Always fast, but never hurry. As we age, it's very normal that we're going to lose collagen. And so this is just rebuilding that collagen. Little pressure pinching here. Very good. How about here? Do you feel pressure, pinch, or a little bit of both? Okay, good. This is all in the subcutaneous plane. So that's what makes it safe. Obviously, you need to know the anatomy, because you certainly don't want to go below the subcutaneous plane in this area. Very good. Perfect. So I'm going to do a little bit more on this side. Let me turn your head this way. That's good. In every area that we add the Sculptra to build the collagen, it kind of has a global effect, so that it will build the foundation, prevent future collagen loss, and contribute to the collagen deposition in the surrounding area. Okay. Feel a little pressure, a little pinch here. A little bit of numbing medicine here. Pinching there, a little pinch. Let's go slowly, a little numbing medicine. Big deep breath in and out. Feel a little pressure pinch. But from here, I can access all through. Pressure pinch. Yeah, there's definitely a little tiny bit of scar tissue. And a little pinch. Let's do some numbing medicine there. Perfect. Little pinch there. So this helps a little laterally, a little tender. Now over here, do you feel pressure pinch? Do you feel a pinch there? So a little numbing. How about now? Pressure pinch? Okay, good. And we're going to go a little bit inferiorly. Perfect. We're going to take a little break, and that's just feeling all through this area. Can you feel that numbness building up in through there? So as the numbness takes effect, you feel less and less through the course of the treatment. And Brittany has everything set up perfectly for us. Makes it very easy. Thank you, Brittany.
You're welcome.
I'm going to have you turn your head this way. Do you still feel lightheaded or not really? That just kind of settled away, right? With the vasovagal response, anything with the lightheaded feeling, that does go away. So that little insertion point, we're subcutaneous. A little pressure pinch. So here, just because there's a tiny bit of that scar tissue, we have to do a little extra numbing. She feels that sensitivity, so we'll go slowly. Pressure pinch. And then through the scar tissue. Afterwards, I like to recommend that 5-minute massage 5 times a day for 5 days. Pressure pinch, a little numbing. Okay, let's take a little break there. Tell me what you're feeling now. Do you feel pressure, pinch?
I'm stinging a second ago. It's not now.
How about now?
No.
Okay, good. Yeah, so it goes away very quickly, and she feels it there. So we're numbing, and I'm going to add a little bit of numbing medicine there. Because there's some of that scar tissue. Do you feel a little bit of a pinch here? How about here, pressure pinch? How about over here, pressure pinch?
No.
Any pressure pinch here?
No.
Pressure pinch here.
No.
So it's okay to take time and do a little bit of extra numbing as needed. Pressure pinch here.
Mm-mm.
Pressure pinch here.
No.
And then little pressure pinch here. Pressure pinch.
No.
Good. Pressure pinch.
No.
Pressure pinch.
No.
Pressure pinch here. A little bit.
Tiny.
So we're just adding a little extra numbing medicine. So there's just a tiny bit of scar tissue from previous treatment, and so this is normal to do a little extra numbing. Over here, a little pressure pinch. Pressure pinch there.
Tiny.
And I'm going to do some little bit of numbing on the other side as well. Very good. You turn your head this way just a little bit. Do you feel some pressure pinch here? A little bit there?
Tiny bit.
See, tiny pinching, most people are like, yeah, I feel a tiny pinch, it's not a big deal. If it's more than tiny, you got to come back and do a little extra numbing. So there she feels more of a pinch, so we're doing more numbing. It doesn't take that long to do some additional numbing medicine. Little pinching there. Everything's looking good. How about here, a little pinch?
Tiny bit.
Very good. Perfect. So we've added a little more numbing. Can you feel that numbness underneath?
Mm-hmm.
Okay, that's what you want to achieve. And then back through this way. Good. All subcutaneous. That's the safest place to inject, and the goal is to thicken the skin and build the collagen. You feel a little pressure pinch here?
No.
Thank goodness for lidocaine. So now I'm just stretching the skin as I'm placing the cannula and guiding the cannula. Perfect. Very good. And we're going to just go back and forth between the two sides. We're a little bit more to go before we're done. I'm going to turn your head this way just a little bit. That's good. Mixing the Sculptra, I like to mix it immediately before I inject. Laura, how are you feeling?
I'm good.
Everything's looking good. You feel a little pressure pinch there, not too bad?
Not too bad, no.
So now that we've got more numbing medicine, that's helping us out. And even though I feel the scar tissue, she doesn't feel really so much there. And that's the ideal. So fortunately, we have plenty of numbing medicine. We use as much as it takes to make patients feel comfortable. How about here, pressure pinch or not really?
Tiny bit.
A little bit, okay. So I'm going to do a little bit of numbing medicine there. And there's numbing medicine inside of the product as well.
Miriam Cullen says, what is the procedure you are performing?
We're using Sculptra to thicken the skin. We can get a little crepey neck skin. And lifting and tightening can be a definitive treatment for that. But this is a non-surgical option. We can use Sculptra for many areas. We can use it everywhere around the body, around the face, cellulite. It's even being used for non-surgical butt enhancement. Anywhere on the body, Sculptra is good because it builds up the collagen. and I feel a little bit of that scar tissue, so then I just twist, twist, twist. For physicians and students that are watching, when you feel that scar tissue, you just need to have a firm grasp of the skin with your non-dominant hand, twisting to gently advance, and you make sure you're staying in the correct plane. And then shiver technique to put a fine amount of the filler over a large area. Everything's looking good. Perfect. A little bit more, then we're done. How are you feeling, Laura?
I'm good.
Laura's tough. Try and make it easier than getting a tattoo. There's no restrictions afterwards. I like to do the 5-minute massage 5 times a day for 5 days. You turn your head this way a little bit. Perfect. So a little pressure pinch here. And just blending and fanning technique. Pinching there, sorry. A little pressure pinch, a little bit of numbing medicine. Everything's looking good. Fillers are the future. Fillers do a great job. We always try and get the best result we can without having to do surgery. But if you need more tightening, we can always do that. So fillers are powerful. We have permanent fillers, and Sculptra is a superior collagen stimulator. So we really like to use that for many areas around the face and around the body. Perfect. Everything's looking good. Little pinch there or not really? So at this point she feels more numb because the more we inject, the more the numbness takes hold. And thank goodness for lidocaine. Laura is definitely a giver. She gives to many people in her personal and professional life, so we love giving to the giver. We want to take care of Laura because she's taking care of others, and we find out when we give to ourselves, we've got more to give. A little pressure pinch there. A little bit more to go, then we're done. Last little area. You can use ice after fillers. It's not mandatory. Sometimes people use ice for comfort or for swelling. If you use too much ice, you can actually cause more swelling. You turn your head this way a little bit. Pressure pinch. Very good. Perfect. Pressure pinch, holding, traction, counter traction. And I feel a little bit of that scar tissue, so you just twist, twist, twist. And then shiver technique for a small amount of filler over a large area. Perfect. And just a little bit more laterally here. If you're just now joining, we're doing Sculptra to the neck and the crepey skin that we get. You can build the collagen and thicken the skin. If you want more improvement to the neck than what Sculptra can deliver, then we would be talking about tightening. But it's always a good idea to build the volume and build collagen. People ask about collagen supplements and do they help? The answer is that they can, but you have to test it and see how your body does. Okay, we're completely done. Hopefully that wasn't too bad. You did great, Laura. How are you feeling?
I'm good.
Very good. So what I'm going to do now, you're not feeling lightheaded at all?
No.
Okay, I'm going to sit you up nice and easy, and then we're going to show you. So as we say, you don't want to taste the chocolate cake before it's done baking, but why don't you take a look through here. And with the volume alone, it helps a little bit of the crepiness. How does it look so far? So it's subtle. We want that to be a smooth appearance. So now the Sculptra, we know it's going to go away 100%, and in 3 to 6 weeks it's going to build. And at 2 months, 6 to 8 weeks, we'll see you back. We'll take some pictures. We'll compare them side by side, and we'll either say we like it, or we can add a little more, or we talk about tightening. But this way, you know the treatment options. Any questions I can answer. 5-minute massage, 5 times a day for 5 days, all through this area. And you can see, if you look really, really closely in the before and afters, there's just a little bit of that crepey skin right in through this area. And so now you can see definitely smoother through here. So thank you for watching. We're on a mission to stop bad plastic surgery. I'm Dr. Rich Castellano. Laura, you did great. I'll see you in 6 to 8 weeks, and we'll see you in the next video. Thank you for watching.